My name is Dr. Deepak Ravindran. I'm a consultant in pain medicine and I work within the NHS. And I'm also practicing privately at the Spire Dunedin and the Circle Hospitals in Reading, Berkshire. Ever since my childhood, I've always had a fascination and a deep interest in biology. But it was around when I was my year 8 or 9, my grandfather became very unwell with a liver disease. And at that time, I found that I was able to explain the situation around his condition and what happens to my family, to my grandparents, and others about the condition. And I found that I was really interested. They found that I could really explain and make sense. And I enjoyed the whole process. And that's what triggered my passion to actually go into healthcare, become a doctor. And a long story short, I've trained in India, where I qualified in one of the tertiary institutes in India. And then I came to the UK in 2003 to further get my training in anesthesia, in pain management, and critical care. And I trained over here in Oxford, and I did my pain fellowship in the University College of London and Stanmore. And I've started and become a consultant in Reading now for the last 14 years. So I've always had a deep interest in pain management per se, because I think it is so fascinating. Pain is a ubiquitous phenomenon. Every consultation that goes, and when you go to a specialist, is with a pain of some kind. Indeed, 70 to 80% of all GP appointments in the UK are due to some form of musculoskeletal pain. And as an anesthetist, that is my role. That was my role as an anesthetist, was to give medications for surgery and to give very strong, powerful pain medication as a part of anesthesia to relieve pain and to keep people pain-free during and after surgery. And I thought, well, a lot of those principles and those techniques that I learned could very well be useful for pain management. And the research showed that there was going to be a huge promise in the type and techniques and drugs that could be used for pain management. There was a massive change in our understanding in the late 1990s and early 2000s. And so when I came to the UK and I did my training in Oxford, I was very interested in pursuing pain management as a fellowship. And that's what prompted me to finish that in UCL. And I realized that there is so much potential opportunity for research, for helping patients, and for making a difference in people who have chronic pain as well. As a part of it, I've learned that not only are the techniques that I've learned in anesthesia in terms of nerve blocks or strong medications useful, there are actually so many other techniques that the general public and indeed a lot of my healthcare professionals are not aware about how chronic pain can be managed. And that's what's driven my passion to become a pain consultant, to take it one step further and actually write a book for educating my healthcare professional colleagues as well as patients about the recent advances in pain management, and then work with other organizations nationally and internationally to raise awareness about pain science education and do my bit in helping people and helping my community. Well, my job right now as a pain consultant, both within the NHS and in private practice, revolves around doing a variety of activities, seeing patients when they're admitted to the hospital before surgery, after surgery, seeing them in the outpatient services, doing nerve blocks, doing ward rounds, seeing patients in the community as well, and doing a variety of discussions with the GP and other multi-healthcare professionals like physiotherapists, psychologists, occupational therapists, health coaches, social prescribers. So when I can help work with these colleagues and put together a personalized plan for a patient who's struggling with chronic pain, who needs to be shown the tools and the skills to reduce their pain, then that really gives me the most passion. That really gives me the most satisfaction when I can bring all of this together and create a meaningful change for the patient. And to be able to experience that at least 1 to 2, maybe 3, 4 times a week, that still gives me the passion, that still gives me the motivation and enthusiasm to keep going. One of the things that I feel very grateful for, and that comes from my patients very often, is the fact that they feel that someone has at least taken them seriously about their pain. Someone has validated their concerns and listened to them for the entire duration. My consultations are usually 30 to 45 minutes long, and sometimes they can go up to an hour. But the most important thing I want to give to my patients is that complete undivided time and attention, so that their story and their narrative can give me so many clues as to what might be the reason for their pain. And often I'm able to come up with a more personalized and appropriate holistic plan that not only has the elements of a injection or a tablet if required, but is able to bring together a more comprehensive plan. And that they appreciate, because that is very unique. That's not been given to them by anybody before. And that's what they find most of value. And I think that's where I find the most pleasure, that if they are able to come with that preparation and that understanding of what they want from me, then I'm also able to help them to the maximum extent. Yeah, no, no, I kind of have this big picture way of approaching. So let me start again on the spot. My view of clinical care, especially with relation to pain management, is what I call trauma-informed integrated pain care. And that means that the recognition and the phrase is that trauma is not what happens to somebody, but trauma is what happens inside of somebody when trauma happens to somebody. And it's very important to recognize that and to be aware of all the factors that can make a nervous or immune system sensitive. So that is the importance of having a trauma-informed approach.